Welcome to this week's class, When Your Health Matters, the class designed to empower you to better health through knowledge and education. And I'm your host, Dr. Richard Huntoon from Advanced Alternative Medicine Center. We are located at 138 Canal Street in Pooler Park, that is in Pooler, Georgia. We're in Suite 404 of Building 400. If you'd like to stop in to the office, I am happy to receive you and answer any questions that you have. Probably offer you a brief evaluation out of my own curiosity to get to the truth of what questions you're asking and what my highest level of understanding would be with regards to why you're asking those questions health-wise. But short of stopping into the office, the next best way would be to call me directly at area code 845-561-2225. Again, 845-561-2225. Please do not text that phone, as that phone is not equipped to receive text, but you can email me directly at docrick, DOCRICK, at spineboy.com. And whether you stop in, call, or email me, it's my pleasure to help you to better understanding what the concerns you have. We've been doing these weekly healthcare classes since the beginning of this year as a result of our current lockdown situation, if you will, the pandemic that has affected everybody, obviously, across the world. People still aren't fully understanding what they can do to help themselves. So this particular class is actually quite apropos in addressing some things that I think is very, very important. This is usually the time of year that they promote needing to get a flu shot as late fall ramps up and we're moving towards winter. The thing that they ask everybody to do is to get a flu shot. I'm going to encourage you not to get a flu shot. Now, this may be a little controversial, but I'm going to go through the reasons why I would suggest you not to get the flu shot. I had a patient. I've had several patients, but this particular one is the one that stands out to me because these were the words that her medical doctor actually shared with her. She was a elderly woman, actress, who had had some lymphoma and had the immune system cells, the lymphatics of her left arm removed in an effort to prevent her health circumstances from deteriorating more. And when it came time for the annual flu vaccine, the doctor injected her in the left arm where she didn't have an immune system, didn't have a lymphatic system, and she basically suffered with the flu for the better part of basically 3 weeks. And after she discussed it with me, I said, well, you should talk to your doctor about that. So she went back to her medical doctor, and the response that her medical doctor gave her, well, what did you expect when you get a flu vaccine? We're actually giving you a reduced strain of the flu in an effort to help your immune system combat the potential flu if you get exposed to it. Now, unfortunately, each year's flu vaccine is an estimated guess as to what they think the strain is going to be. And based upon what we've seen over the last 20 months with COVID-19 and the different variants, I guess people are a little bit more aware of the fact that maybe the shot that they get isn't going to help them specifically with the strain of flu that's going around. So I'm going to encourage you not to get the flu shot. I'm going to encourage you to avoid eating completely refined and processed sugar, which has a tendency to deplete your immune system, overstimulate it, and tear it down and end up creating immune system weakness when you consume white sugar. I'm going to ask you to eat lots of whole foods, both the fruits and the vegetables, in an effort to help your body have good building blocks, in an effort to strengthen your body's immune system and resolve. I'm going to ask you to exercise. Exercise if you can every day. If you can, every other day. But you want to get in some level of regular exercise to help the body function better and promote normal function. Um, I'm going to ask you to do something that they validated while I was going through school as a chiropractor, to get an adjustment. Every time you get an adjustment, it actually boosts your immunity. It stimulates your T helper cells, which are the cells that help you fight off infection. So getting an adjustment would be important. If you haven't been in for an adjustment, I'm going to encourage you to come in and get an adjustment so that your immune system can be that much stronger. Something we've all been encouraged to do, certainly over the last 20 plus months, is to wash your hands. I'm going to ask you to wash your hands with anything but antibacterial soap, because you don't want to destroy your microbiome that's on the surface of your skin and create opportunities for pathogens to get in through your hands. So avoid the antibacterial soap, avoid the hand sanitizers. These are things that are going to create a weakness in your immune system. Cover your mouth if you're going to cough. It's just common courtesy, and one of the ways to help keep things from moving around. Avoid big crowds, which I don't know is going to be that big of a deal right now, because we've avoided big crowds for the last 20 months. But yeah, stay away from big crowds. Pathogens can be fostered in large groups of people, and so avoid big crowds. Continue doing what you're doing. Interacting with those who have received the flu vaccine could potentially, due to shedding issues, create the flu for you, because you're being exposed to that. And that's been something that people have known for quite some time, but I don't know, there's a lot of rhetoric out there that says that it doesn't apply to the COVID-19 vaccine, but I'll let you decide for yourself. I'm not here to tell you yes or no with regards to that. Next step is to get proper amounts of sleep. A lot of people are deficient in sleep. As a result, their bodies run down, and if their bodies run down, then they're going to be more open to having their border walls violated and things getting in that don't belong in. I guess the most important thing I could ask everybody to do is don't worry. Probably 99% of the things that human beings worry about never actually happen. So I'm going to ask you not to worry. It's good practice to live life by. Avoid the flu by not worrying about the flu. See if that works for you. Now, there are some nutritional supplements that you can take which will help to boost your immunity. These are both for the flu. This is just for general sicknesses. This is for COVID. These are all the things that I would ask you to do to help boost your immunity so that you don't have to worry about these things. Calcium lactate is the best form of calcium for you to take in. It gets converted by the acids in your stomach right into the form of calcium that your body needs to maintain strong, integrous immunity, along with every other function within your body, which is calcium bicarbonate. Calcium bicarbonate is not stable in a solid form. It's only available in a liquid form, and you get that through artesian well water or mineral water or spring water in various levels of concentration, artesian well water being the highest concentration, mineral water being second highest, and spring water being third highest. But if you want to supplement your calcium, and I recommend everybody do, calcium lactate. I personally take 6 of those a day, 2 with breakfast, 2 with lunch, 2 with dinner. Second supplement to help boost your immune system is Cataplex C. It's the whole food vitamin C complex. Helps to stimulate your macrophages, which are the cells that actually eat up infection. So calcium lactate will keep things from getting in, but if things get in, then you have strong macrophages because they're getting plenty of vitamin C to eat up any infection. That would be healthy. If you're worried about viruses, being the flu virus is a virus, so we would want you to take Immuplex. Immuplex is a formulation that is designed to help ward off viral infections. We would recommend that you take that. I personally take 6 of those a day, 2 with breakfast, 2 with lunch, 2 with dinner. That's me personally. If you're worried about co-infections, because co-infections could become a thing or is already a thing, I don't know. Congaplex, which is a natural antibacterial. So you got your Immuplex for your viruses and Congaplex for your bacterias. Um, that would be good. If you're somebody that experiences mucus, I get lots of phone calls for people who are suffering from mucus, and I would ask you to take the whole food supplement called fenugreek, or Fengree is the name of the supplement. It's actually fenugreek seed powder, and when you take that on an empty stomach with a big glass of water, it gets into your system and runs around and eats up all the mucus in your body like Pac-Man. So it just kind of runs around and eats all of it up, and that would be a good thing so that you're not trapping infection and creating health issues. Um, Something to help stimulate your immune cells to produce more immune cells would be a supplement called Thymex, Thymex. That helps to stimulate your thymus gland to produce more immune cells. It's vitally important. And last but not least, there's a herb out there called Echinacea Premium. I take 3 of those a day, and that would be something to just help keep your immune system high and everything functioning the way that it's supposed to. And so um, I'm going to encourage you, if you're considering getting a flu shot, not to get the flu shot. Avoid completely refined and white processed sugar. Eat lots of whole food, fruits and vegetables. Exercise. Get an adjustment. Cover your mouth. Wash your hands. Avoid big crowds. Get proper amounts of sleep. And most important, don't worry. Be proactive, and then you never have to be reactive. So I hope this was helpful. If you have any questions, please get a hold of me. You can call me directly at area code 845-561-2225. Again, 845-561-2225. You can email me directly at docrick@spineboy.com, DOCRICK@spineboy.com, or you can stop into the office at 138 Canal Street in Pooler Park. That is in Pooler, Georgia. We're in Suite 404 of Building 400. And however you get a hold of me, it's my pleasure to help you to better understanding what the concerns that you have, answer the questions that you have, and make sure that you can go forward in life, leading a healthy life and having happy days. So thanks for tuning in. Tune back in next week. Same health time, same health station. This is Dr. Richard Huntoon signing out for now, and thanks again.